young people. Is that your primary concern for both sides?
Certainly the fact that there have been exposures over a number of days that go back in time is a concern. You know, it's pretty clear that we have run down multiple generations of transmission just in the last 48 hours. That's been extraordinary work. And so finding the primary close contacts and getting them tested and identifying their own contacts and getting them tested and going to the next ring has been fantastic. But there's been a lot of chasing to be done effectively because we have had those individuals out in the community for some days in the past. So there are potential exposures there that relate to some days ago that, you know, are yet to potentially play out with new cases.
The advice you gave
With case 5, which is effectively case 1, are you confident that you've got everything everywhere that person has been? And you look at that person as a super spreader?
Well, certainly case 5 has given us all the appropriate information. We have tracked down all of the primary close contacts and I'm not aware that anything's been missed in that regard, but that individual was infectious. So there are clearly a number of primary close contacts who've become cases from that case.
in terms of
on the bars, can I just go back to that? On the bars, are people using QR codes? Is there effective information there to track those people, especially the early hours?
Yeah, I don't know for these specific cases, but I think in general there's been good QR use. I would encourage everyone to use it at every instance, whether it's a mandated site or not, whether you're going there for 1 minute or 1 hour. It's a really ususeful thing for us to track down.
How are you going? What's concerning you the most about it? Would you go to lockdown? Is it more exposure sites or someone not being linked?
Well, there are a whole bunch of elements we always look at, and we review everything every day. As the Acting Premier said, the next 24 hours will tell us if we've got further confirmed cases in the primary close contacts, 300 of which are known, and only 80 of which have returned results so far. Almost all of the remainder will come through today, but the exposure sites that they then generate, how many close contacts they might have, and how long they've been out in the community. So they're all factors that we need to consider over the next 24 hours.
Brett, did you consider recommending to James and Martin any further public health measures over the last 12 hours, or are you happy with the settings we've got?
No, as we've said, we'll have it all under review through further investigation of the epidemiology today. But you know, the ink is barely dry on restrictions from last night. We will go through today's cases and all of the details behind them.
And on the missing links, I was asking you yesterday about missing links in terms of yesterday, in terms of these new cases. Have we run all that to ground, or is there more to emerge in terms of links between everyone?
We may still see further links. So the only missing link is the link to the Wallet case from South Australian hotel quarantine. All other cases, all of our 15 cases in this cluster are linked. So we understand the relationships between all of them. We've got an explanation for how transmission has occurred. We may see new people coming forward testing positive that either tell us what that missing link is with the Wallet case. In a sense, it really doesn't matter. We want everyone who's symptomatic to come forward and test. If they're linked, if they're unlinked, you know, we need to run it down the same way.
How concerned are you that we don't yet have that link between the Wallet man and this false case?
Look, it is a concern whenever we have cases with unknown acquisition, and so that's case 5 essentially. You know, that case has done the right thing in giving us all of the information, and all of the subsequent investigations are running down, you know, the chains of transmission subsequently. But there could be other cases out there. That's why we say, you know, whether or not we identify you as a close contact or a casual contact, whether or not you've been to an exposure site, if you're symptomatic, please get tested. And that's the mildest of symptoms. It could be a runny nose, a sore throat, a fever. It might be aches and pains. It might be lethargy and a headache. It doesn't matter. Get tested.
We've seen a jump in cases
Sorry,
and
Rich.
also...
How many health workers have been furloughed as a result of this outbreak?
I don't have those details. The management of healthcare settings is with the healthcare setting itself. They're not part of the public exposure sites.
Do you have a little bit more confidence in more frontline workers being vaccinated? That you're a little bit more concerned?
Yeah, there's no question that the front-facing and most at-risk healthcare workers have been vaccinated at very, very high rates, almost universally. There'll always be maintenance as people move through in different roles. The broader healthcare worker workforce is pretty substantial, you know, hundreds of thousands of individuals, but they're coming forward as well, and there's a very good coverage with them, and many of them are up to their second doses now. So that's an absolutely reassuring thing.
And on the vaccines, this group of 15, how many should have had the vaccine? How many qualified for the vaccine?
Don't know.
How many over 50, I guess?
I don't know.
And
We can dig down.
Reports today that 3
one line of-
Victorians aged over 50 at the centre of this outbreak hadn't been vaccinated despite being eligible. How are we doing the right thing when it comes to vaccinations? How can this be improved?
We know there are still millions of over 50s who are yet to get their vaccine. I know many of them will have started booking now. Many of them turned up yesterday. That's fantastic. There are many tens of thousands, hundreds of thousands who can still get vaccinated now and should get vaccinated now. The concerns about clots, I understand. This is the same vaccine, AstraZeneca vaccine, that's been given to over 20 million people in the UK. The UK that is now down from 60 plus thousand cases per day to 2.5. It is getting over its pandemic through this very vaccine. There is always a risk with medications. And as vaccines go, and as the risk of clots go with the AstraZeneca vaccine, that is a much, much smaller risk than for so many other things in life.
How concerned are you that people in this cluster aren't yet vaccinated?
Well, it's my concern in this cluster, but across the population more generally. So if you're eligible, please come forward now, make a booking for today, for tomorrow, for the weeks ahead.
On Port Melbourne, there's a lot of cases that come out of that one office. Is that a result of someone going to work consistently sick?
So, you know, a lot of people are asymptomatic and can still transmit. A lot of people will transmit before they develop symptoms. I don't have the specific details for these cases, but, you know, the message again to all Victorians, don't turn up to work, don't turn up to any events, don't go to family gatherings of any size if you've got symptoms of any kind. Get tested, isolate, get that negative result, and be happy that you can go to work when you're recovered.
You said yesterday that case 5 had likely been infectious as early as May 15. He didn't get tested until 10 days later. You've said you're confident that all the people who caught the virus from him, caught the virus since are linked. But how concerned are you that there could be people out there who caught it from him without realising it, given that he was out there for 10 days?
Yeah, of course I'm concerned. A lot of people have developed COVID from this individual. It is not to blame any one individual. We have all had contact with others close to us with sometimes very mild symptoms. And the message remains the same. You really must isolate and get tested, get that negative result before you should be interacting with others. But of course we're concerned. There's been transmission. It speaks to the infectiousness of this virus in general terms.
And just on the potential for a lockdown, you locked us down in February as a result of the UK strain of the virus. There was a lot of rhetoric at the time about that virus spreading at light speed and that being the reason for the lockdown. This Indian strain is regarded as being twice as infectious as the UK strain. Why lock us down then and not now? So
we will review through the course of today and tomorrow and the next day, whatever the settings are on any one day, we will look at that against the epidemiology. This particular variant, B1617, the sublineage 1 doesn't appear to be as bad as sublineage 2, which is the one that has taken over in India as the predominant strain, looks to be the predominant strain in the UK as well. So this lineage that is part of this cluster may not be as bad, but you're right, it's probably at least as transmissible as the B117 or UK variant, and we will have that in mind as we consider the epidemiology today.
Have
Are
the
you confident
genomics,
that these
Julia,
measures-
has the
Sorry.
genomic sequencing results come back on most of the cases?
Yeah, so they will continue to come through as cases get notified each and every day. They have all come through with that same variant and with the same relatedness to the Wallet case.
Are you confident that these measures are enough right now? This virus has now touched regional areas as well.
As I say, we've run down 4 generations in the last 36 hours of transmission. That is a fantastic job. But we remain concerned by numbers. We remain concerned by the fact that we will have further exposure sites identified. What comes out of that is what we're watching today, and we'll continue to watch going forward.
If we're concerned, why are we waiting?
Sorry.
New cases in Ballarat.
Might let the Minister speak to that.
Just in regards to, just in regards with the people who've had the AstraZeneca 1 jab, is it worth them getting Pfizer their second jab, given we've got an outbreak of immunity and its effectiveness against the Indian variant?
No, not at the moment. That's for ATAGI, the Australian Technical Advisory Group on Immunisation, to make the call on. But AstraZeneca single dose provides good protection. It provides extremely good protection against hospitalisation and serious illness, and so it's just worthwhile to get that vaccine. It should be followed up on current recommendations 12 weeks later with the second dose. The mixing and matching of vaccines is a matter for ATAGI nationally, but there's no reason to believe that you can't get a follow-up dose with AstraZeneca that doesn't work extremely well.
Should national efforts on the vaccine be concentrated with Victoria, given after an outbreak? Would you like to see more vaccines going from other states and the risk is lower coming to Victoria?
The issue now in Victoria is people coming forward to get the vaccine. We've got the supply, we've got the infrastructure to deliver it. We want people to book in, to walk in, and to get the vaccine. So I don't think there needs to be some shift in the distribution of vaccines nationally. That said, the most at-risk individuals are the ones that we'd like to see prioritised, and that needs to happen across the country.
We have no jab, no play rules. Should we be looking at that for COVID vaccine?
Again, a matter for
James?
National Cabinet.
Do you know what portion of elderly Victorians, those 70 and above, have got at least 1 dose of the vaccine, and what role, if any, does that play in our ability to resist further restrictions or lockdown?
I don't have the exact figure. I think it's getting to a reasonable level now nationally, not at that safety zone of herd immunity, if you like, for that cohort of people. And the protection of those 70 and above is not just their own vaccination status, but it's everyone getting vaccinated, all of those that they might interact with. I do know that the aged care system, private and public, has had extremely good coverage, especially in the city of Whittlesea. So that's reassuring, but there'll be new residents going into aged care as well, so there needs to be a maintenance program of vaccination in those settings also.
Does it play a role in your thinking on further restrictions at all?
It's not a primary role. It's something I'd like to obviously see continue take up of vaccine for those most at risk. But in terms of the transmission risk, the transmission potential, vaccination is not at the kind of levels that make a difference now to the speed of new generations of cases.
Given that
Is
testing,
there any prospect of localised restrictions or lockdowns, or are we beyond that?
Well, we've got it in essence with Metro Melbourne, but we've got significant spread of exposure sites at the moment, so it's not something that we would look to at a postcode level, I think.
Professor, are you comfortable that the AFL's going ahead on Friday night?
So we are reviewing today and through the rest of the week those settings, so nothing more to say on that.
Is there a chance that will be slashed?
So there's everything's on the table in the review of restrictions, including for public events. Everything's on the table.
Can I just ask one variant? We are still dealing with the Indian variant for all of these cases?
We are. It's the Indian variant for all cases.
There are reports that one of the latest cases is a Melbourne Metro Trains customer service officer. Are you aware of those?
I'm not aware of that.
So you don't know whether
I don't know.
it is?
I have a question on an unrelated COVID
well,
matter.
is it testing?
No.
Just really quickly, we're still seeing massive delays. I know that you acknowledged some sites of increased capacity, Martin, but people are being turned away, and this is the critical 24 hours. Are you doing anything to fix that? Because people could become